Prediabetes, a delicate and often underestimated metabolic condition, is characterized by elevated blood glucose levels that, although not reaching the criteria for a diabetes diagnosis, signal insulin resistance. This prelude to type 2 diabetes presents a unique opportunity for proactive interventions and lifestyle changes, with a special emphasis on healthy eating as a crucial tool in preventing progression to a more severe condition. Understanding the complexity of this intermediate phase requires a deep analysis of underlying metabolic processes. Insulin resistance, a central component of prediabetes, implies that body cells respond reducedly to insulin action, resulting in lower efficiency in glucose absorption. If not managed properly, this condition can evolve into type 2 diabetes, where the body's ability to regulate glucose levels is further compromised. In this context, diet plays a crucial role in modulating risk factors associated with prediabetes. The choice of foods, proper distribution of macronutrients, and portion control are fundamental aspects to consider. The complexity of carbohydrates, the quality of proteins, and the role of healthy fats in metabolic regulation deserve careful scrutiny. Moreover, it is vital to understand that prediabetes is not merely a matter of glucose analysis numbers. It is a state that reflects the intricate interaction between genetics, lifestyle, and environmental factors. Therefore, dietary strategies cannot be universal approaches, but must be personalized to meet the specific needs of each individual. In this context, exploring diet tips for managing prediabetes becomes an exercise in discernment and deep understanding of metabolic nuances. These strategies are not just practical suggestions, but an invitation to delve into the intricate biochemical and nutritional mechanisms governing metabolic health. Let us then delve into this intricate landscape of prediabetes, unraveling the secrets of diet as a powerful tool in the pursuit of prevention and lasting well-being. 1. Weight control. Maintaining a healthy weight is essential to prevent the progression from prediabetes to type 2 diabetes. Visceral fat, especially around the abdomen, is associated with increased insulin resistance. Adopting a multifaceted approach, including a balanced diet and regular physical activity, is crucial. The diet should focus on a moderate caloric deficit, ensuring adequate intake of essential nutrients. 2. Proper macronutrient distribution. A balanced distribution of macronutrients plays a crucial role in blood glucose control and weight maintenance. Choosing low glycemic index carbohydrates, lean proteins, and healthy fats is essential. Proper portion control based on individual needs, health goals, and activity levels is a key component of a balanced diet. 3. Complex carbohydrate choice. Opting for complex carbohydrates is a fundamental strategy for controlling blood glucose. These carbohydrates, found in whole grains, legumes, fruits, and vegetables, contain essential fibers, vitamins, and minerals. Considering the glycemic index is crucial, as low GI foods are absorbed more slowly, avoiding abrupt spikes in blood sugar levels. 4. Portion control. Effective portion control is a strategy to avoid caloric excess and maintain a balanced energy intake. Using smaller plates can visually trick the brain into perceiving larger portions. Mindful eating, savoring each bite, chewing slowly, and paying attention to hunger and satiety signals helps prevent overeating. 5. Avoid processed foods and added sugars. Avoiding processed foods and reducing added sugar intake is crucial for prediabetes control. Processed foods often contain saturated fats, refined sugars, and additives that can negatively impact metabolic health. Reading nutritional labels is essential to identify and avoid added sugars. 6. Incorporate lean proteins. Including lean proteins in the diet is crucial for weight control and metabolic health. Lean protein sources, such as chicken, fish, eggs, legumes, and Greek yogurt, provide essential nutrients and are lower in saturated fats compared to fattier protein sources. 7. Stay hydrated. Proper hydration is often underestimated in prediabetes management. Water plays an essential role in various bodily functions, including nutrient transport, temperature regulation, and elimination of metabolic waste. Replacing sugary drinks with water reduces empty calorie intake and added sugars. 8. Monitoring glucose levels. Regular monitoring of glucose levels provides valuable information on how different foods and lifestyle choices affect the body's glycemic response. Home glucose monitoring devices allow individuals to track trends and make necessary adjustments. Collaboration with healthcare professionals helps interpret data and adjust strategies as needed. 9. Regular exercise. Regular exercise is a cornerstone in prediabetes management. Physical activity promotes glucose uptake by cells, reducing insulin resistance. The type and intensity of exercise can vary based on individual fitness levels and preferences. Establishing realistic goals and incorporating physical activity into daily routines are crucial for consistency. 10. Consult a healthcare professional. Regular consultation with a healthcare professional, such as a nutritionist, doctor, or endocrinologist, is essential in prediabetes management. These professionals can assess overall health, provide personalized guidance, and monitor progress over time. Collaboration with healthcare providers ensures informed decision-making for optimal health. Incorporating significant changes into one's routine may seem challenging, but the transition to healthy eating habits and effective prediabetes management can be achieved gradually. Here are some strategies to adhere to diet tips and integrate them organically into daily life. 1. Self-awareness and goal setting. Start by evaluating current eating habits, understanding preferences, and identifying challenges. Set realistic and measurable goals, such as increasing vegetable intake, reducing processed food consumption, or controlling portions. 2. Meal planning. Dedicate time to weekly meal planning, including choosing healthy recipes, creating shopping lists, and prepping ingredients in advance. Planning reduces reliance on convenient, often less healthy food options. 3. Gradual transition. Make changes gradually to avoid feeling overwhelmed. Introduce 1 or 2 dietary modifications each week for a smoother adaptation and sustainable long-term habit building. 4. Smart substitutions. Identify healthy substitutes for common ingredients. For instance, swap white rice for brown rice, choose whole grains over refined products, and replace processed snacks with nutritious options like fruits or nuts. 5. Stay hydrated. Prioritize hydration by keeping a water bottle accessible and developing the habit of regular water intake throughout the day. Add fruit slices or herbs for flavor if desired. 6. Learn to read nutritional labels. Develop the skill of reading nutritional labels while shopping. This helps identify unwanted additions like added sugars and saturated fats, enabling more informed choices. 7. Introduce foods enjoyably. Explore new recipes and cooking techniques that highlight the variety and quality of healthy foods. Trying new flavors can make the transition more enjoyable and less monotonous. 8. Family involvement. Share your goals with family or housemates. Involve them in dietary changes to create a supportive environment. Family meals can become opportunities to explore healthier options together. 9. Be mindful of the food environment. Keep the home stocked with healthy options. If possible, minimize the presence of processed and sugary foods in your home environment, making mindful choices easier. 10. Continuous learning. Stay informed about nutrition and metabolic health. Seek reliable resources, read about nutritious recipes, and explore new culinary approaches. Continuous learning can inspire and strengthen your commitment to a healthy diet. 11. Seek professional support. Consider seeking guidance from a healthcare professional, such as a nutritionist. An expert can offer personalized advice, address questions, and provide support during the transition to healthier eating habits. 12. Celebrate small achievements. Recognize and celebrate each achievement, no matter how small. Whether it's choosing a healthier option in a meal or consistently meeting goals, positive acknowledgement reinforces motivation and encourages ongoing efforts. Remember that the journey to healthy eating habits is unique for each person. Gradual approaches, continuous learning, and adaptation to your personal routine are essential for a sustainable and successful transition. Numerous scientific studies emphasize the importance of incorporating healthy eating habits and an active lifestyle in prediabetes management. These investigations provide valuable insights into how these practices can positively influence metabolic markers and reduce the risk of developing type 2 diabetes. Below are some significant studies highlighting this relevance. 1. Diabetes Prevention Program in DPP-I study. The DPP, a multi-center clinical trial, demonstrated that lifestyle changes, including a balanced diet and regular physical activity, significantly reduced the incidence of type 2 diabetes in adults with prediabetes. Adhering to a calorie and saturated fat-reduced diet, combined with increased physical activity, showed a 58% reduction in the risk of developing diabetes. 2. Research on complex carbohydrates and fiber. Studies, such as those published in the American Journal of Clinical Nutrition, suggest that choosing complex carbohydrates and fiber-rich foods can help control glucose levels. Adequate fiber intake is associated with a lower glycemic response, improving insulin sensitivity and reducing the risk of progression to type 2 diabetes. 3. Meta-analysis of physical activity studies. A meta-analysis of studies, presented in Diabetes Care, concluded that regular physical activity, especially aerobic and resistance exercise, reduces the risk of type 2 diabetes in individuals with prediabetes. Physical activity improves insulin sensitivity, contributing to better glucose control. 4. Study on healthy fats and insulin sensitivity. Research published in the American Journal of Clinical Nutrition highlights the association between the intake of healthy fats, such as omega-3 fatty acids, and improved insulin sensitivity. A diet rich in omega-3 fatty acids, found in fish and nuts, is linked to metabolic benefits, reducing the risk of developing type 2 diabetes. 5. Investigation into gradual diet changes. A study published in Diabetes Research and Clinical Practice explored the effects of gradual dietary changes on prediabetes. It concluded that small modifications, such as smart substitutions and portion control, are more sustainable and effective in the long term in reducing risk factors. 6. Research on hydration and metabolic health. Studies, including those presented in the Journal of Clinical Endocrinology and Metabolism, highlight the importance of hydration in regulating glucose levels and insulin sensitivity. Adequate hydration is a simple yet effective strategy in prediabetes management. 7. Assessment of health education programs. Research evaluating health education programs, as presented in Diabetes Educator, underscores the effectiveness of educational interventions. In-depth understanding of nutritional principles and lifestyle impact can motivate individuals with prediabetes to adopt lasting changes in their dietary routine. These studies provide a robust foundation for the significance of diet and lifestyle in preventing the progression of prediabetes to type 2 diabetes. Incorporating healthy eating habits and active life practices not only reduces the risk of developing diabetes but also promotes overall improvement in metabolic health and well-being.